Thank you, Rasta. Thank you. Where is Zoltan? I can't start with actually out him here because we have two patients, and I am not about to have Liz take up a gun and start shooting at the entrance. All right, EMS, welcome, welcome. So here today we are going to be doing a full anatomical nanite reuptake and reinfusion. What that means is that we're going to remove the old nanites from Sir Markel and Ma'am Liz, and we're going to replace them with the new nanite X89, and that is the new nanites that is going to be infused into their body. The old nanites that they have, which is Nanite X80, is outdated and it is dilapidating, which is causing them to have low performance and causing them to not be able to keep up with their standards, especially the standards that they set upon the soldiers. So we are going to reuptake those old nanites and reinfuse the new nanites. Sir Zoltan, since you are the chief AMU director, can you please come here and please read them their rights?
Yep. All right, body cam record sessions for documentation only, confidential doctor-patient only, unauthorized disclosure will equal to disciplinary action or dismissal upon the decision of leaders. Treatment equals in agreement to these rights. Do you accept these terms?
Okay.
Mm-hmm. And then this one will be for all the doctors and who will be working on the patients.
Yes, sir. Okay.
So I need everyone to read that and then agree to those terms.
I, Susan Winston, swear to preserve life, ease suffering, restore readiness, treat with respect, no bias, do no harm. Breach of information equals to discipline or removal by leaders. This I promise to uphold.
All right.
Sir Crazy Eyes is going to be a surgical intern, so he is not going to be performing, he is going to be observing. Actually, Crazy Eyes, are you observing or are you performing as well?
I can perform as well, but I'm just observing. If need be, I can step in as well, though,
Copy
and
that.
do little things.
Copy that. Okay, so Anthony and Rasta, I need you to say the oath, just so that you're under penal code that shows that you say the oath.
Do no harm. Breathe. The information to declare discipline / removed by leaders. This I promise to uphold.
I, Crazy Eyes, I swear to preserve life, ease suffering, restore readiness, treat with respect, no bias, do no harm. Breach of information equals to discipline / removal by leaders. This I, Crazy Eyes, promise to uphold.
All right, everybody's taking the Hippocratic Oath. It's now in your hands, ma'am, Susan.
Okay. All right, everyone, let's sanitize. Let us get our gloves. Let us prepare. And we are going to begin with Sir Markel. As you know, Sir Zoltan, you are going to stand guard. Make sure that no one interrupts us. Make sure that our backs are protected. And we will begin shortly. Sir Markel, is there anything that you would like for me to put on your procedure, or is there anything that you would like to tell me before I put you under anesthesia?
Nope. I I do have one quick question. We are going to be putting the X89, the new X89 in him, correct?
Yes, we are up. We are re-uptaking X80, and then we are going to reinfuse X89.
Okay. I just wanted to make sure I pulled up. You are. It's a new upgrade that I developed with a small team of scientists. So you'll basically have regenerative powers like Wolverine.
All right, I'm going to begin now. Once I inject this into your system, I'm going to inject 30 cc's of an anesthetic from this injector. No needle will be needed. It will go into your pores and it will gradually go throughout your body and knock you out. All right. 30 cc's of anesthetic is injected into skin pores. Okay, now this is what we're going to do. I'm going to work, because this is a very new nanite experiment, and I don't want to make sure that it overwhelms the body. We're going to do this into two separate surgeries. So today we're just going to do the left foot and left leg, because since this is experimental nanites, I want to see how it actually works and how it does. And if it does work well within the week, I will continue on to the rest of the whole body, which is right foot, right leg, abdominal area, intestinal area, left hand, left arm, right arm, and the brain. As for right now, we are going to do the left leg and the left foot only, just so that we can see if the nanites will respond good the whole week. That will go the same with Ma'am Liz, and we are going to see what's going to be, the result. As for the chest and the lungs, I want Dr. Moore to work on his chest and lungs, because I want to make sure that the nanites, the new nanites, have an expanded area to work. So once I finish with the left leg, I want Dr. Moore to make sure to work on his heart and lungs as well. So Dr. Moore, as you can see, you will be working on the heart and lungs. You are the cardiothoracic lead surgeon. You are the chief of that department, and so you will be taking that procedure. As for me, I will be doing, like I said, the left leg, left foot. So as I'm doing it, Dr. Moore, if you would like to start on the heart and lungs, I wouldn't mind, but just make sure that you monitor his vitals and make sure that it is not above at least 100. Okay, so yes, ma'am, we'll keep you updated. Okay, so we will begin. I will take my scalpel and then I will begin with this procedure. All right, so it looks like here that the nanites are successfully draining in. Give it a moment while I drain the left foot. I need someone to wipe off the residual bleeding of the left foot, please. I want to make sure that there is no excessive blood loss. So if someone can just use the gauze to wipe off the residual bleeding, that would be great. Thank you. Okay, so here's what we're gonna do. So I'm gonna take the X89 syringe, and what I'm gonna do is I'm gonna inject it into the wall. I'm going to observe for positive reaction. If not, then I'm going to use certain medications to kind of give it a little beat, and I will keep observing until for successful reactions. So here we go. I will now inject the new Nanite X89 into his left foot. Alrighty. All right. As you can see right there, the nanites are swimming around. They are starting to get used to the muscle wall of the left foot. As you can see, they are starting to do repair. But I want to see. Let's see if it positively infuses with the blood. Okay, so it looks like it's not successfully infusing. So here's what I'm going to do. I'm going to put about 5 cc's of diphenamine into the left foot, and let's see if that reacts positively to the nanites. If not, then I will do a higher dosage. Okay, so it looks like here that the 5 cc's are not working. I'm now going to amp it up to 10 cc's. And there we go. So, as you could see, please come around and take note. As you could see, the nanites are already successfully infusing into the muscle wall. As you could see, it's already healing his muscular tissue. So I'm actually going to do a very, very simple stitch because the nanites are actually going to heal his left foot. Within a matter of like an hour, maximum 2 hours. So as you can see, his cellular tissue is regenerating. His muscle wall is not tearing, and as you can see, everything is coming into play. His nerves, his red blood cell count is elevating. As you can see, it's already sealing up on its own, and that is the power and the innovation of Nanite X89. Okay, so now that we're done with the left foot, now we're going to do the left leg. And the left leg is going to be a little bit bigger because the foot is going to be was a lot smaller and the leg is a lot longer. So we are going to now do the left leg. I know this is new technology for you guys, and I know this is something that isn't normally seen in HP, but this is the work that I've been doing with Army before I came back to HP, which would be biosynthetic development and biotechnology and biochemistry. So if you guys are interested, I have a few more surgeries that you can look at after this one. So this is your chance to re-glove, re-sanitize, and make sure you're re-clean. Because we are going to go onto the left leg, and then after I do the left leg, that's when Dr. Moore is going to do the heart and lungs. So okay, so there we go. Okay, so when you guys are ready, I'm going to begin on the left leg. All right, incision complete. And now we are going to use the retractor, use the same method, and we are going to go in. Let's see how this goes. Alrighty, so as you can see here, muscular tissue on the left leg has been opened, and I am now making sure to drain out the X80 nanites. As you can see, they are kind of decrepit and dying already. X89 should last a lot longer. Typically saying it should last years to come. So let's see the next steps. But yes, what has happened? What has happened? Okay, good. Okay, so I will continue. Alrighty, so there we go. The nanite should now be in his left foot. Oh my gosh, hold on. Sorry about that. That's supposed to be his left leg. Hold on. There we go. Okay, the right macro was used. There we go. Okay, so now that the nanites are inside of his left leg, I'm going to now see for a positive reaction. And as you could see right then and there, as you could see, because that the infusion was successful in the left foot, it was successful in the left leg as well. And as you could see, because of that, I will only need to do minimal stitching, and you could see that he will recover within at least a matter of 2 hours. No need for ER care. No need for long care. It just needs to recover, and the stitching will dissolve on its own. So I will now close, and I will now hand the floor over to Anthony, to Dr. Moore, as we begin to transition from the legs onto his heart. And in particularly speaking, Dr. Moore will infuse the nanites into his heart. That way, he can have a much more easier breathing, and the nanites will be able to adjust to the newer nanites. That way, all the adjustments will be a lot more easier when I work on the right leg, the right arm. Oh no, the right leg, the right foot, the right hand, and the right hand. I'm sorry, I am like tired. The right foot, the right leg, the right hand, the right arm, the left hand, and the left arm. So, thank you for that. I will now close them up. Alrighty, so as you can see, the stitching is not going to last long. Here's now what we're going to do. Dr. Moore is going to do the nanite infusion, and we are going to have him take over from here since his specialty is cardio. I will inform his wife, Ma'am Liz, on the procedure, and then I will step back and assist only when needed. You doctors are going to make sure that the heart and lungs are going to be properly stimulated and properly injected with the nanites, and Dr. Moore will be on top of the case. So I will now step away. I will now re-glove and re-sanitize, and Dr. Moore will begin his part of the procedure, and I will inform Ma'am Liz. Okay. Hello, ma'am. So, I would like to inform you. Oh, she's asleep. Okay, hold on. Ma'am? 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 I have to update you on your hi ma'am, it's your daughter, Dr. Susan Winston. I'd like to update you on your husband's surgery. Um, so the surgery was a success. The Nanite X89 was successfully implanted in his left leg and left foot. And it looks like there was a succession rate of 100%. And it looks like he's going to have an enhanced foot. Now, I know today was supposed to be full anatomical. However, I want to make sure that the nanites have a full infusion in his left foot and left leg. Once I see that his legs and his leg and foot, or his left leg and left foot, has readjusted very well, I will go ahead and come back and do a full anatomical reinfusion. Give me a quick second, ma'am. Not tonight. That would be next week because I have to observe it first. Please give me a quick second, ma'am.
Excuse me.
Okay, so I am going to observe and I'm going to stay here and assist if needed. But let me finish updating Ma'am Liz. So, Ma'am Liz, yes, so next week, yeah, because I'm going to also...
Look at the number 190.
So, I'm going to do your procedure after Markel. I'm also going to do your left leg and your left foot. And then I'm going to observe you both throughout the entire week. And if in the entire week that your left leg and left foot adjust good to the Nanite X89, I will schedule another surgery to do a full anatomical Nanite reinfusion. And that means I'm going to be doing all of your body, your hand, your right hand, your right arm, your right foot, your right leg, your left hand, your left arm, and also your brain. But as of today, we're just going to do the left foot and the left leg plus the heart. And then after that, we're going to see a week. And then if everything goes well, we're going to continue it. Would that sound okay with you? Okay, perfect. So I'm going to do that. So after Markel is done and after he's rolled into the recovery room, it should only take him about like an hour or two to recover and he can be back on duty because the nanites are healing him up very, very nicely. The nanites are, it looks like it's infusing well within his system, a lot faster than Nanite X80. Yes, I can definitely schedule the same day as his as well. So if you're gonna schedule like today, that we what's it called? That we did so, we can definitely take note again. Okay, I can definitely do Saturday. I can definitely do Saturday. And as you can see, they are doing their best work to upgrade his heart as well. I will actually go back in there and I will observe and assist, but I will keep you updated as they finish, okay? Perfect. All right, I'll keep you updated, ma'am. All right, EMS team, I am here to assist you. I am here to make sure that if you need any assistance, please let me know. I will be checking vitals and I will be making sure that the patient's blood pressure and heart levels are going to be stabilized. I will just be here to assist if you need me. Okay, so it looks like here that Nanite X89 is a success, and it looks like here that Nanite X89 should be successful in his heart as well, heart and lungs. Okay, so okay, I see. I'm so sorry about that. I was disconnected, but I am back. Okay, let me just resanitize here. There we go. All right, how's our patient doing? Okay, so it looks like Dr. Moore is injecting 4 cc's of valsartan, and that's actually a really, really good choice. Valsartan is a medication that is able to stabilize heart rate and stabilize blood pressure, so that is an excellent choice. Now it looks like Dr. Rasta is adjusting anesthetic levels for safety and comfort of the patient, which is amazing as well, making sure the patient is comfortable. All right, let me take notes of all this.
Excuse me, y'all. Hey, can y'all retire me from this bullshit? I need to be the
Sir,
fuck out of
you need
this
to leave.
right now.
You need to leave. We're in the middle of something. You need to leave.
Oh, okay. Well, I'ma just. Oh, well, you said leave, right? Direct order, right?
And there we go. That's actually amazing. Look at that heart reaction. Healthy, strong, pumping blood. Look at how the nanites are literally increasing red blood cell count. Oh, that's magnificent. Look at that heart pump. Look at that lung pump. Ooh, oh my gosh. Oh my gosh. I shouldn't be this excited. I'm sorry, but like to see how the nanites are actually working and to see how his heart is just absolutely wonderful and beating stronger than ever with the nanites, it's a wonderful thing to see. Okay. So let's see if the lungs do the same thing. Let's see here. Do you have any questions, Crazy Eyes, or do you have anything that you would like to inquire on as this procedure continues on? All right, no problem. If you have any questions, just let me know. I'd like to go over some nanite procedures if you have those. If you are interested, and there we go, and there we go, and there we go. Look at that strong lung reaction. Look at how the nanites are literally making his lungs more filler, able to take in more oxygen, and working well with the newly upgraded heart. Look at that. Thank you, Crazy Eyes. Yes, this is amazing technology and you have to thank Army for this. I would not have been able to do my research if they did not sponsor me back when I was still working on this, when I was still in the Army Medical Unit. I literally would not have been able to even bring up the idea of nanites or nanobots. So you really have to thank the Army for funding this research, because they carried me throughout my first term of medical practice. That, and you also have to thank Zoltan over there, because without Zoltan, Nanite X89 would have not come into completion. He took some of the best scientists and best medical experts from the Army and basically designed X89, which is a lot better than X80 and could possibly even be better than X92. Okay, so heart rate seems stable enough. So it looks like, and his heart rate is, I can hear his beating. It's beating like a battle drum. It literally sounds a lot stronger, a lot sturdier, and it sounds amazingly plump. And especially in a world where heart issues can abound, it is absolutely amazing to hear this type of heart pumping in a person. It's absolutely amazing. Good job, Dr. Moore. I'm always happy to see your expertise in this field. All right, so after you close up and send Markel to the recovery room, we will now work on Miss Winston, which is his wife, and we will do the same exact thing that we did with Markel to Liz, and then we will send them off into observation for a week. And then if all goes well, we will schedule them again on Saturday, same time, same area, and we will discuss further treatment, which is the full infusion of nanites. Alrighty, good. So, the nanites will take care of his heart. It will also take care of the internal reconstruction of the cellular cardiac wall. It will definitely heal up on its own. Just make sure to slowly place him into the recovery room in the back. And make sure that he lays in a bed very comfortably, and the nanites should fix themselves. And I will now prep Miss Liz for her surgery while you guys take care of Sir Markel. Okay, so let me just sanitize here.
I'll be back. I gotta go handle something real quick.
No problem. You should be fine, though.
Susan,
Yes, Dr. Moore?
area's already been sanitized.
I'm sorry, what?
Area has already been sanitized.
Oh, yes. I'm talking about me. Oh, you a hoe. I can't believe I caught that on camera. The doctor should not be talking like this. Oh my god. So now I'm going to get my anesthetic gun, and I'm going to inject it into her pores of the neck, and it's going to be the same thing, 30 cc's of anesthesia, and it is going to knock her out. So we will begin now, and we will see how it goes. Is there anything else you want to tell me aside from being allergic to medical tape and latex? So everyone here, remember, she is allergic to medical tape and latex. So please only use carbon fiber tools and bandages that are made of gauze or anything that isn't made from latex. So yes, the vitals did drop last time. I made sure to have the proper medication in the case. So, and Dr. Anthony as well has the proper medication in the case that it drops on his end as well. So, it's okay, ma'am. It's okay. I understand this is a very, very complicated procedure, especially if it's only in just the left leg and left foot. But I promise you, you are not going to flatline. I will be there for you. I will make sure to bring you back. You are in excellent hands. Dr. Anthony, Dr. Rasta, Dr. Crazy Eyes, we are trained to make sure that we keep our patients on the table alive and to make sure that you see the sun again. All right, ma'am. Okay. All right, let me get this ready for you.
I do note I'm terrified of needles too.
It's okay, ma'am. We're not using needles. I am using an anesthetic injector, and the anesthesia is gonna enter through your pores, and it's just gonna make you sleep right away. No needles, no nothing. So apologies once again. My Wi-Fi was going out. We will begin the procedure now, and I am reinstating body cam. Okay, now that anesthesia is in, I will now begin once more to the left foot procedure. Alrighty, so now that it's open, and now that I have it there, it looks like the suction is draining the old X80 from Miss Winston's left foot, and it should be draining quite nicely. Okay, here we go. Thank you for your patience. I don't know why the game is doing this, but I will now continue. Okay, so it looks like the nanite isn't quite adjusting yet. I am now going to infuse some medication to see if it will react along with the medication. All right, increasing dose to 10 cc's. So, just like Markel, it looks like her left foot responded to 10 cc's of diphenhydramine. So, now that it's doing this, I'm going to close up and I'm going to now move on to the left leg. All right, there we go. Left leg is now open and extracted. All right, I will now begin the nanite infusion process. Okay, so it looks like it's not reacting as quickly either, so I'm going to inject 5 cc's of diphenhydramine, and we shall see. All right, actually, that's actually really impressive now. So it actually responded to only to 5 cc's, which is a lot quicker. So now I'm going to close up the leg, and Dr. Anthony is going to work on the heart once more. Okay, well, okay, so hold on. Her heart did stop. Her heart did
It's
stop
clear.
beating.
Alright, clear out. Oh yeah, I can go out now. Copy that.
So here's what we're gonna do. I'm gonna inject 10. So I did see that the heart is stopping to breathe. So, could someone what's it called? Dr. Moore, did you stabilize her heart while I was while I was disconnecting it? And I'm so sorry once again for my internet connection just doing this. I deeply apologize. Oh, you used AED?
Your internet seems to be worse than Liz, and she lags all the time.
Pa, go recover over there. So, oh, professional. Good. Good. You used AED, so which means her heart should be stabilized. Good. Okay, so I'm gonna close up her left leg, and then Anthony should be working on her heart right now. All right, there we go. Inject. Okay. The anesthetic should be kicking in right now. And the anesthetic, Rasta did adjust your anesthetic safety. So, it should be fine. But I am going to inject at least. Okay, no, it's fine. Okay, perfect. Okay. I'm going to re-glove and re-sanitize. Okay, here we go. Another successful nanite transplant from Dr. Moore. Excellent. Excellent. Absolutely excellent. And there we go. That's her heart is beating extremely strongly. It's stable and it is absolutely amazing. The fact that the nanites are already holding her cardiac cavity into place. The fact that it is literally it's repairing her cardiac tissue. Amazing. Absolutely magnanimously amazing. Dr. Crazy Eyes, if you would like to scrub in on the next surgery, if their nanites are successful for the week, you can definitely scrub into my surgery next Saturday. Oh, hold on. I gotta put her back under. Okay. There we go. The anesthesia should be in you right now. Okay. Okay, there we go. Oh, thank God. Oh, the Lord have mercy. Dr. Rasta put in the medical note that I need to reevaluate and readjust my anesthesia levels in the anesthetic injector because I cannot have patients wake up like this. She was in the middle of cardiac nanite infusion. Yeah, so thankfully, the body takes about 3 minutes to process pain after anesthesia. Woo! That was good. That was a good save. And yes, it does say in her chart that this happened last time. So, again, we are going to need to. I'm actually going to run a blood test here, so give me a second. So, Dr. Anthony, while you finish up with the heart, I'm going to run a blood test. Okay, I'm going to take these blood samples to the lab. And I'm going to run tests because I need to see what's exactly inside of Miss Liz's blood, because apparently she wakes up a lot more faster than patients. So I need to okay, her heart rate's beeping fast. I'm gonna inject 10 cc's of adenosine. Adenosine should be should lower her heart rate. Give me a second. All right, there we go. Adenosine has been injected, so her vitals should be returning to normal. So normal, it poofed. So, yeah, you're good, you're good, you're good. So, it looks like the adenosine should be working. The patient should be in a stable thing. So, you're good, Liz, you're good, you're good. Alright, so patient should be stable right now, and right now we are just going to wait for Anthony to finish up the nanite lung infusion, and then we can call it a successful surgical day on 2 patients. And 2 very important patients, should I say. I will actually update Liz's husband. So I will go update him right now while you guys finish. Okay, Sir Markel. So, I just want to update you on your wife. She's actually doing very, 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 very well. The nanites in her left foot and left leg have been successfully reuptaked and infused with the new Nanite X89. So she should be recovering very, very fast. Our doctors right now is actually doing your wife's heart and lungs, and it looks like the doctors are successfully reuptaking and reinfusing your heart and lungs with the Nanite X89. So yes, your wife is doing very, very, very well, just like you're doing. However, I do have concerns with her ability to resist anesthesia. I already got 3 vials of her blood because I need to analyze like what makes her wake up so much more faster. And I will make sure to develop a much more stronger anesthetic liquid so that it can, her procedures can be much more smoother. Hold on, I can see the heart rate monitor going off. Hold on, I'll be right back, sir. Okay. I got this. Hold on. There we go. There we go. There we go. Oh, there we go. There we go. That should be able to lower the heart rate and lower patient reaction. I've increased 10 cc's of adenosine to 20, and this should be able to relax the patient until it's done. Okay, hold on. Looks like the adenosine isn't working. Okay, I'm going to try 15 cc's of diazepam. Give me a quick second. Okay, hold on. Yes, you were successful, Dr. Moore, which is I'm very proud of you. You did amazing as usual. I am right now just trying to lower her heart rate. So I injected 15 cc's of diazepam, and the diazepam should be taking effect. Okay, let's see here. Okay, good. Heart rate's been normalized. Once you close up with her heart, just give it basic stitching. The nanite should be able to repair itself on its own. What you can do is after you stitch, roll her into the recovery room, and she should be fine within 2 hours. Okay, I think we are done here. So it looks as if Dr. Anthony will roll Miss Winston into the recovery room. She should be able to recover within 2 hours, just like Markel, and everything should be fine now. Good job, everyone. We did an amazing surgery, and you guys did your first biosynthetic, biochemical, and biodevelopmental surgery with me today. Congratulations. That was amazing.